Thank you. Hi, everyone. Science runs on trust. We trust that findings are accurate, that analyses are fair, and that results are reproducible. But that trust can't just rest on good intentions. It needs evidence. And one of the strongest ways we can offer that evidence is through data sharing. Good afternoon. My name is Vincent. I'm a medical student from the University of New South Wales in Sydney, Australia. And today, on behalf of my supervisor, Dr. Aidan Tan, and his research team from the University of Sydney, I'm very excited to be presenting to you a cross-sectional meta-research study. So a bit of background before we begin. This study was done at the University of Sydney, which is in Australia. So before you all ask me, yes, we have a lot of kangaroos, snakes, and spiders jumping around in our backyards. And when I was making this presentation, I realized that similar to kangaroos, data can sometimes be hard to catch and even harder to share. And that's exactly why data sharing matters. You see, when researchers share their data, it prevents their findings from getting lost. Instead, the data stays accessible, where it can be reused, re-examined, and built upon. And this improves transparency. It gives confidence in the findings that are published, and it enhances the overall accountability we have in our research community. Now, in recent times, journals have recognized these benefits, and they've responded to cultural and practical barriers by implementing policies which now either require or recommend data sharing for any articles that they publish. And we recently showed that 19% of the highest impact medical journals require data sharing and 22% recommend it. However, it remains unclear whether researchers are actually adhering to these data sharing policies. For instance, there was this study that was done at the University of Rochester where researchers found that the comprehensiveness of a data sharing policy had no association at all with researchers' compliance. But then in another study, which looked at gene expression profiles, it was found that the strength of data sharing policy was positively associated with the prevalence of data sharing. So what's going on here? Our objective, therefore, was to systematically describe researchers' adherence to journal data sharing policies. And this included describing A, what factors impact data sharing, and B, how these factors impact the intent on authors to share their data. So this was a cross-sectional study of all original research conducted in 2022. And essentially, for journals to be included in our criteria, they had to fulfill three main points. Firstly, they have to have ranked top 5 in impact factor across the 59 different fields of medicine. Secondly, they needed to have a data sharing policy which either required or recommended sharing data. And finally, they needed to have published original research. We excluded book publications and duplicate journals that appeared in more than one journal. So data was collected on two main variables, the study characteristics and the data sharing plans. For the study characteristics, we collected data on the study type, whether there was industry involvement, and whether the study was related to COVID-19. For the data sharing plans, we looked at both the initial and the final data sharing plans. And the initial data sharing plan came from publicly available research protocols. And the final data sharing plan, well, that came from the publication itself. And within each of the data sharing plans, there were two main elements. The first element was essentially a data sharing statement. And this simply referred to whether there was the presence of a statement at all within the research protocol or publication. And the second element was the data sharing intention. And this referred to the decision that was made by the authors within the data sharing statement as to whether they would share their data. Now, if the final intention was to share their data, we collected data on the what, when, why, with whom, and how authors would share their data. And if the final intention was to not share their data, we extracted the author's reasons as to why not. And in instances where both the initial and final data sharing plans were available, we compared them along the way to see if the authors had changed their minds at the end. So we included 134 journals. Over a quarter of these journals require data sharing, and the remainder recommended it. Almost 2/3 of journals required data sharing statements, and the remainder either recommended, mentioned, or had no clear policy on these data sharing statements. Interestingly, only 2 journals recommended sharing data from COVID-19 studies. And what we found was that within these 2 journals, 63% of authors actually intended on sharing their data, whereas the remainder didn't. For the studies itself, we included just under 2,000 interventional studies and just over 10,000 observational studies. Over a quarter of these interventional studies had industry involvement and few were related to COVID-19. Few observational studies had industry involvement and even fewer were related to COVID-19. One of our key findings was that even in journals with policies recommending or requiring data sharing, only about half of the studies said that they actually intended to share. So specifically, that equates to 55% for interventional studies and 45% for observational studies. And what we found was that even when authors did say that they were intending to share their data, it was oftentimes limited. For instance, they'd only share their data if the data was related to the underlying published results. Or they'd only share their data if it was with other researchers. Or they'd only share their data if the principal investigator approved of it. So essentially, data was only shared on their terms. We also looked at what factors increased the likelihood of sharing data. And what we found was that stronger journals, so journals that require data sharing or data sharing statements, made a clear difference. And this was also the case with industry involvement and COVID-19, specifically within interventional studies. And among those published in journals that require data sharing, approximately 58% ultimately changed their intention and planned to share, compared with only 42% in journals that merely recommended it. In contrast, though, in journals that only recommended data sharing statements, these proportions were much lower, 26% for interventional studies and 25% for observational studies. We found that the most common reasons for authors intending to not share their data was that the availability of aggregate data was perceived as sufficient. Now, this is a misconception. It's a misconception because aggregate data is not the same as individual participant data, which we know is critical for replication, secondary analysis, and for overall transparency. Journal data sharing policies should include a clear, unambiguous definition of data sharing and individual participant data, and also an explanation on the utility of individual participant data and aggregate data. Furthermore, we think that journals with data sharing policies which require data sharing should also review the data sharing statements of journals or studies which do not intend on sharing data at manuscript submission and ensure that their justifications are both reasonable and accurate. Interestingly, journals that require data sharing statements, even if they didn't actually mandate the data sharing, saw the largest absolute increase in researchers intending to share their data. And this was 45% for interventional studies and 33% for observational studies. There's a number of reasons why we think this may be the case. One of the most pressing reasons could be that researchers tend to follow specific submission guidelines much more closely than editorial policies. And importantly, it suggests that simply requiring investigators to put in their intention upon their final submission could perhaps change their direction and change their behavior in a more positive direction. In short, though, most studies which intended to share data only stated that they will do so upon request. And we know that prior research has demonstrated this to be both inefficient and ineffective, because oftentimes these requests are frequently ignored or denied. On a more positive note, though, however, in journals with stronger data sharing requirements, authors intended to share more, not only data, but also supporting documentation. And we found that they did this in a more timely manner to more people, for more purposes, and by easier means. And therefore, this suggests that when journal policies are backed by clear guidance and active enforcement, perhaps data sharing practices could improve. And so this brings me back to my introduction. Science runs on trust. That trust can't just rest on good intentions. It needs evidence. Robust data sharing is one of the key ways we can provide that evidence, as it not only enhances the transparency of science itself, but also the reliability that we place on our authors. Thank you.
Thank you, Vincent. That was great. And And we have people at the mics already, so we'll start over here in the front.
Thank you, Maria Kowalczuk, Frontiers. So did you check for those papers where the authors declared that they would share the data? Did you check that it's actually available via as a repository or in the manuscript or anywhere else?
So I wasn't actually involved in that aspect of the research, but it's a great question. I don't think we actually checked whether that data was available in the repositories or the sort of databases that we have available. It'd be really interesting to see if the data was available and whether that actually matches the data sharing intentions. Thank you for your question.
Thank you.
Okay, and we'll go front over here.
Markus Krivars, Helsinki, Finland. Thank you. Important work. So with clinical trials, when you ask consent from a patient or a family to consent to use of data, it becomes a bit tricky. How do you write it in a study information form? Well, you'll be included in the trial. I'm going to collect data on your health, on your outcome, how you are, and we'll freely share it. So I think it's not that easy. And of course, we can say, okay, it's anonymized data, but I'm sure you may have heard of the GDPR, and there is virtually nothing that is anonymized anymore. So it's all pseudo-anonymized. So I would, if anybody else have experience with this, how is this actually written in study information forms? And are relatives actually happy to say, yes, I'm happy to be a part of this trial? And if a researcher in whatever country wants to access this database and my data, then that's fine in the sake of science, because it's not that easy. And the lawyers of the hospital they're very tricky with this, and it has to be for example, with storage of data, where they're stored. And it becomes a bit strange if you store the data very strictly somewhere, but then when this data is published, you can send it anywhere. So what's your views of that?
Yeah, great question, and thank you for coming up to ask that question. Look, mate, I think you've got an excellent point, and it is perhaps an interesting area of exploration within the data sharing industry and open science journals. I think the idea of data sharing is that, yes, we want to make sure that we share as much data as we can, but you're absolutely right. There's a fine balance that we need a balance, especially for like randomized controlled trials where there's interventions and we're using sort of confidential data. How can we make sure that this is de-identified? It'd be interesting to do sort of this research and exploring specifically in that field that you've mentioned about how or whether relatives or perhaps patients in that clinical trials are willing to openly share their data or perhaps not. Yeah.
Okay, at the back on the right. Thank you.
Matthew Stanbrook, CMAJ. And in addition to being a journal editor, I'm also an observational researcher who works with large clinical and health administrative data sets, many held by governments. I'm wondering how many of the people in your study cited their inability because of legal and ethical requirements to share data the way they would want to, which is something a researcher like myself encounters often. And how are you judging that in terms of how you interpret what is normative here, and what solutions do you see to enable more data sharing in the face of these important restrictions that are there to protect critical personal health information?
Yeah, thank you so much, Matthew, for your question. So within this study, we essentially looked at the data sharing intention, and we also looked at the differences between requiring and recommending sharing data, right? So you have to realize that, well, why are journals recommending data sharing? Why are they just not requiring data sharing, right? Would there be a particular reason as to why journals particularly are recommending data sharing? And I think off the top of my head that perhaps maybe confidential information, or there's definitely instances where it wouldn't make sense to share data at all. And we have to account for those possibilities. And I think the idea within this study is to say that, well, as much as we can, we want researchers to share their data, but in instances where they can't, that's where the data sharing statement can come in. And that's where I talked about making sure that the statements are both reasonable, they're accurate, and their justifications are sort of believable and make sense.
Yeah, I think we have one back here.
Hi, Dietmar Wolfram, University of Wisconsin-Milwaukee. Thanks for the presentation. Beyond the journals either requiring or recommending data sharing, did your study also see if there were any requirements or recommendations for adopting FAIR principles for the data?
Could you elaborate a bit more about?
Findable, accessible, interoperable, and reusable. That's fair principles of data sharing.
Yeah, yeah. I don't think with this study we did look at those fair principles of data sharing. It's an excellent field of research that would perhaps open up windows of opportunities to go down this path. I think definitely with a study like ours, we can sort of jump on and use it as a springboard for future developments in this area. So to answer your question, no, we didn't actually look at it in this study, but perhaps in the future.
Okay, thank you very much.
Thank you.
And I think we have some from online.
One question from online, Bahar Memani from Elsevier asks about geographic differences in willingness to share data. Do you see certain countries less or more willing to share data than others?
Yeah. I think when I was involved in this aspect of the research, what our research team was that North America was actually quite open in terms of geographical sharing data. Off the top of my head, I can't remember many of the other geographical locations, but that would be an interesting finding to see and put into our final manuscript. Thank you.
I'll just ask one question then if there are more. I mean, maybe it was not within scope of this study, but did you look at which databases were being used? Because there are, I mean, you can have a requirement for sharing data and still have restriction and still allow some exceptions, and patient data is always a complicated question. And there are some databases that actually have restricted access, so that everyone can access the aggregate data, for example, and then it gets more difficult to access data as privacy increases. Did you see any of that?
Not specifically with our research study. Because so we included obviously the top 5 journals within like the different fields of medicine. It'd be really interesting, like you mentioned, because some of the databases would have restricted access, and to see and compare these values and the sort of data sharing prevalence within this aspect.
Right. Okay. We have one more question.
Nihar Shah from Carnegie Mellon University. So there's the discussion about releasing de-anonymized data, and in the past, from many different attacks, we know that just saying de-anonymization and removing names, or even doing few more things, is not sufficient. There's this very famous Netflix attack, which Netflix had released this data. You probably know about it, right? Anonymized data, and then people broke the anonymization and identified the users. There are so many such data sets which people have released as anonymous or de-identified, but then people re-identified it. So my question is, if you're insisting on releasing this kind of data, even de-anonymized, what are the privacy standards that you would, what this journal should ask for? That it should meet these strong privacy guarantees, and only then I will be allowed to release that.
Yeah, great question, Neha. I think with the importance of privacy and confidential data, it's important to make sure that that information remains confidential and doesn't get released for open access. But like I said earlier, I think it's a fine balance, and that's where the data sharing statements would come in, and really making sure that these data sharing statements or even general requirements saying that, oh yes, perhaps we want to push authors to share their data as much as possible, but there are certain instances where we're gonna have to accept the fact that we are unable to share their data, and that's actually for the better rather than for the worse. And to draw comparisons to your Netflix, I think it's a balance that we have to dig deep into, and to really pin down on both the journals and the authors to make sure they're doing the right thing.
Yeah.